We are hearing a lot about diabetes. So what happened in last 10, 15, 20 years in our country?
That is the lifestyle disease. Diabetes is labeled as a silent killer. If they don't take insulin, they can land up in life-threatening complications. The gestation diabetes occurs during pregnancy. They might get a silent heart attack. Depression is the most common mental disorder that you get along with diabetes. So insulin is a life-saving medication. India has one of the best doctors across the world. India, in fact, is known as the pharmacy for the world.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ. ನಾವು ಇತ್ತೀಚಿನ ವರ್ಷಗಳಲ್ಲಿ ಡಯಾಬಿಟಿಸ್ ಬಗ್ಗೆ ತುಂಬ ಕೇಳ್ತಾ ಇದ್ದೇವೆ. ಸೊ ಈ ಡಯಾಬಿಟಿಸ್ ಅಂದರೆ ಏನು, ಅದನ್ನು ಹೇಗೆ ಕಂಟ್ರೋಲ್ ಮಾಡ್ಬೋದು, ಅಥವಾ ಅದು ಬಂದರೆ ಅದನ್ನು ಹೇಗೆ ಮ್ಯಾನೇಜ್ ಮಾಡೋದು, ಇದರ ಬಗ್ಗೆ ಮಾತಾಡಲಿಕ್ಕೆ ನನ್ನ ಜೊತೆ ಇವತ್ತು ಡಾಕ್ಟರ್ ಬಾಲಾಜಿ ಜಗನ್ಮೋಹನ್ ಇದ್ದಾರೆ. ಇವರು ನಮ್ಮ ದೇಶದ ಒನ್ ಆಫ್ ದ ಟಾಪ್ ಎಕ್ಸ್ಪರ್ಟ್ ಇನ್ ದಿಸ್ ಫೀಲ್ಡ್. ಸೊ ಐ ಆಮ್ ಸೋ ಹ್ಯಾಪಿ ಟು ಹ್ಯಾವ್ ಡಾಕ್ಟರ್ ಬಾಲಾಜಿ ವಿತ್ ಅಸ್. ವೆಲ್ಕಮ್ ಡಾಕ್ಟರ್.
Thank you so much. Thank you, Prashant, for doing this podcast with me. And I would just like to share my experience in terms of how diabetes has exploded in the country and what are the things that we need to look at so that we can try to change the landscape, how this disease is evolving.
Sure. Doctor, my first thought is maybe last 10, 15 years, we are hearing a lot about diabetes. If this is something to do with human body, I'm sure it should be existing from very long time, right? So what happened in last 10, 15, 20 years in our country?
Yeah, so as you rightly pointed out, there is a lot of rapid urbanization, industrialization, and a lot of countries have imbibed this capitalization in their country. So what has happened because of that? A lot of rural areas have transformed into urban areas. People have been migrating a lot. So a lot of people are settling down in urban areas. Smaller towns are getting more urbanized. The population is increasing. And with this rapid urbanization, the lifestyle is changing. So what our ancestors used to lead, the kind of lifestyle, is very different from what it is currently. So if you see the yesteryears, people were more physically active. They used to
True.
lead a life in the farms, having more of healthy foods. And they used to be more physically active. But now what has happened, people are leading a very sedentary lifestyle. Thanks to, technology, people, travel in cars and high-end mobiles. They're using all kinds of, gadgets in their day-to-day life. So all that has made life very comfortable, but at the same time, very sedentary. Everything is very easily accessible.
So what you're trying to say is like we feel our lifestyle has improved, we have more materialistic benefit, but there's a price we are paying for it.
It's the price we are paying, because with this comfort comes a lot of these lifestyle diseases like diabetes, hypertension, cholesterol issues, heart issues, fatty liver, obesity. So all this has risen purely because of the sudden lifestyle changes that have happened over the last 20, 25 years.
I can completely relate to this, doctor. Like when I was growing up, I remember in my hometown, many of them used to either walk or use bicycles. But today, if I see like last 10, 15 years, I've seen bicycles have been replaced by motorcycles. But today, if I see car, even in my village now, maybe we have 60, 70 homes, but every home has at least 2 motorcycles. So I can visualize even village life nowadays has changed. So very less physical activity, and maybe you're saying that is one of the major reason for this diabetes to explode in last 10, 15 years.
Absolutely. So, when you talk about diabetes, that too, particularly type 2 diabetes, it's more of a genetic disorder. So it's actually acquired or inherited from your family. That's how the normal theory used to be. But now even people are not having a family history of diabetes, but still they happen to get it at a much younger age. So it's purely because of the lifestyle, the food that we eat, the sedentary lifestyle that we live, the stress levels. People nowadays, you see, are very stressed. You have a very short span of time within which you have to do a lot of things. And apart from that, also lack of sleep, or shift workers, people working in the night, sleeping during the day. So all that has affected the circadian rhythm or the biological clock of the body, which brings about a lot of hormonal, metabolic changes within the system. At the end of the day, we are all human beings, right? We're not machines that we can work at any time of the day. So that is something many human beings fail to realize, and then they succumb or fall prey to these metabolic diseases.
Interesting. However, my other question would be some of the things what you have mentioned, we can't change it. That's how the society has been. Like for example, if you see the growth in the technology industry, what has happened in India in last 20-25 years, the jobs are coming to India because of the flexibility. We can work in different time zones. So these are some of the practical realities what we are going through. In between this, how do you think, like we need to manage our health or like work on some of the aspects what you have mentioned?
Yeah, so see, it's about a choice that you have to make. If you want to adopt a lifestyle of that sort, where you're trying to work in the night, sleep during the day, then your system is going to get disturbed. And these are the repercussions or the price that you'll have to pay. But if you have to minimize or mitigate the risk to some extent, then there are some changes you'll have to bring about. You cannot just have a sedentary lifestyle and continue that kind of a work style. So you'll have to probably do some deep breathing exercises. You'll have to maintain your body weight. You'll have to exercise, probably during the daytime when you're about to sleep, just some time before that. So some kind of changes you'll have to bring, which might probably reduce the risk. But still, most of the clinical studies and data point out that once your circadian rhythm is disturbed, then the risk of getting diabetes and metabolic diseases is very high.
Interesting. Doctor, you mentioned about different types of diabetes, right? So can you elaborate a little more on that?
Yeah, so if you see, the most common type of diabetes is type 2, which comprises of 95% of all the diabetes. And that is the lifestyle disease that we are talking about, type 2. Apart from that, the remaining 5% are type 1 diabetes. So that we call more of a juvenile. It comes during a young age, less than 10 years of age. And these children do not have insulin in their body at all. So the cells that produce insulin within the pancreas are completely destroyed. So lifelong, these children have to be on insulin. If they don't take insulin, they can land up in life-threatening complications, something called diabetic ketoacidosis, and they can even die. Then you have gestation diabetes. Gestation diabetes occurs during pregnancy. So during the second or the end of the second trimester and beginning of the third, ideally around 28 weeks, the pregnant woman might get diabetes. But that is a temporary one. Immediately after delivery, the diabetes will completely resolve.
Okay. So for that, no need of any special treatment.
Special treatment means only during the gestation, during that pregnancy period, they have to be on insulin, they have to follow a good diet. And once after delivery, they won't require any medications. But they have a risk of becoming a type 2 in the future if they do not lose weight and if they do not follow a good lifestyle.
Okay. Interesting. You're saying everything is coming back to lifestyle, right?
Correct. And apart from this, sorry to interject, there are other types of diabetes, but they're very rare. They're only less than 1%. Genetic syndrome, something called MODY, LADA, fibrocalculus diabetes, secondary diabetes. So these are all very rare, and you might require some higher testing, like genetic testing and all, to find out this kind of diabetes. But 95% of the entire pool of diabetes is type 2, which is the lifestyle disease.
Understood. Now, let's imagine it in the normal lifestyle, right? People will not go for preventive health check, or people will not get like their health check done in the regular routine, right? So what are some of the symptoms a person should watch for if he or she like getting into a diabetic related issues?
Correct. So now talking about type 2 diabetes, 60% of the people will not have any symptoms. So it's a silent disorder. It causes silent complications. That is why it is very difficult to diagnose this condition. It's only that when your blood sugars are above 300, that is when they might get some symptoms like increased thirst, increased urination. Some people might have weight loss. Some people might have infection in their teeth or private parts, or even a skin infection. That is when they go to a doctor and they ask them to screen or check their blood sugars. So 60% of them having their blood sugar less than 300 will be asymptomatic. Above 300 with some symptoms that prompt them to go for a checkup, and that time they come to know. So actually how many months or years someone is living with diabetes we do not even know if they're in the asymptomatic period. And many a times I've seen in my practice, when you first detect them to having diabetes, they come with high sugars, their HbA1c is about 12%, and already some complication in the eye, in the kidney, in the feet, or even the heart would have had started.
Okay, I think what you're trying to say is, irrespective of your age, maybe too safe to say that maybe once you cross 30, it is better to get the regular health checkup done.
Correct. So if you see the Indian population, they are getting diabetes at a much early age as compared to the Western population. In fact, a lot of studies have given a name for this. We call it the Asian Indian phenotype, which means that Indians are generally very thin. They have thin hands, thin legs, but they have more of abdominal fat. And that abdominal fat might not necessarily quantify them as having obesity. If you check their BMI, it would be between 18 to 23, which is normal. But they are still metabolically obese because of this abdominal or central obesity. And that still puts them at a risk for insulin resistance, to develop type 2 diabetes and other metabolic conditions like dyslipidemia, that is cholesterol issues, or even hypertension.
Very interesting thing what you told, doctor. Like somebody is having a maybe a bigger central portion or abdomen. That doesn't mean that uh, all of them will get diabetes or will have diabetes, but there may be other challenges maybe associated with that. Doctor, another maybe to like on the lighter note, I remember my own father who had both the hypertension and diabetes. He always used to tell me for Sprite, he will put some salt to nullify the effect of the sugar. Right? I used to say like, what stupid logic, right? But can you explain something like how people come to you with some such myth? And do you remember patients coming to you and trying to teach you how they are managing their diabetic situation?
Yes. So this is something that we constantly face, because these are all, age old or ancient, practices or rituals that have been carried out. And once someone does it and he gets some benefit out of it, then the entire society is told about this practice. Same thing happens. One challenge that we face is there are a lot of Ayurvedic practitioners, Unani, who do not even understand the pathophysiology, the basic understanding of diabetes. So they practice a lot of things which are not ethical, which are not scientifically backed. Now, this is one instance what you mentioned. There are other people who feel, that, for example, if you put some methi seeds or something that is bitter, if you drink for a long period of
Yeah,
time,
I heard that. Yeah.
that might prevent diabetes, or you don't have to take your medications. You just
Yes.
do that and you can stop your insulin, you
Yeah.
can stop your tablets. See, that might help to an extent, but not to an extent where you can completely discontinue. Or they practice some other things, ancient rituals, waking up in the morning, doing some pujas, or consuming certain foods that scientifically doesn't have any backing. But it is being told by, their age-old ancestors to follow that, or maybe the Ayurvedic practitioners, and they do it and they delay the right treatment for diabetes, and by that time they land up in complications. So most of the patients that I see, they come with complications because many of these things have been tried.
Yeah, because see, we also, I also heard somewhere, maybe in the previous generation, this threshold to call somebody diabetic was reduced overnight, and then a lot of people became diabetic. Is it true, or what is the reason behind some of these
So
beliefs?
whenever, modern medicine talks about the threshold for diagnosing someone with diabetes. So for example, now we have the HbA1c. So globally, HbA1c is an accepted metrics for diagnosing and monitoring diabetes. So if the HbA1c is above 6.5 in a person who's otherwise not a diabetic, then he can be labeled as diabetic. Now, why do we say that? Because above 6.5, a lot of studies have shown that the HbA1c being in that range for a longer period can cause organ damage and lead to some of the complications of diabetes. It can be a heart disease, it can be a stroke, it can be kidney disease, it can be fatty liver, it can be people losing their eyes. So that is why the threshold or cutoff of 6.5 for HbA1c, fasting above 125, and postprandial above 199 is taken purely because they develop the complications related to diabetes.
No, I think I also heard in my own friend circle or relatives, right? So people are saying, "Hey, I always have 350, nothing will happen, and like my body can take it." Is this diabetic, this threshold is also depends on the body type, or how much dependency it has on a individual?
So that is purely individualized. Now, as you rightly said, there are some people living with blood sugars 300 to 400 at that point of time, not having any complications.
Yeah.
But that doesn't mean that they will not have it in the future. Living with high blood sugars above 300 for a longer period of time is exposing your organs to a prolonged damage. And diabetes is labeled as a silent killer. It will not happen immediately. Over a period of 5 to 10 years, they might get a silent heart attack. And heart disease or heart attack is the most common cause of death in a type 2 diabetic.
You
Which is
might say
mostly
lot of people are getting sudden heart
Yes.
attack, but
Yes.
you never know. One of the reason maybe the long term blood
Uncontrolled
sugar,
diabetes.
uncontrolled blood sugar.
Correct.
Doctor, now let us talk about if somebody is suspecting that they have maybe having high blood sugar. What should they do immediately?
So immediately they need to go and get themselves checked for their blood sugars and the presence of complications, not only about the blood sugars. Along with diabetes, they can have hypertension, cholesterol, they have to check their body weight and the presence of complications. So the eye, the kidney, the feet, the heart, and the liver, they have to mandatorily check
Okay.
because all these complications can be silent in nature. Some people, they might have some symptoms. For example, only for neuropathy, ಕೆಲವು ಜನ ಹೇಳ್ತಾರೆ ಕಾಲಲ್ಲಿ ಉರಿ ಬರುತ್ತೆ ಅಂತ. So that is only one of the symptoms that they might experience. But ಕಿಡ್ನಿನಲ್ಲಿ ಇಲ್ಲ ಕಣ್ಣಲ್ಲಿ ಹಾರ್ಟ್ ಅಲ್ಲಿ ಏನು ನಿಮ್ಗೆ ಸಿಂಪ್ಟಮೇ ಕಾಣಿಸಲ್ಲ.
ಟೆಸ್ಟ್ ಮಾಡಿದ್ರೆ ಮಾತ್ರ ಗೊತ್ತಾಗುತ್ತೆ.
ಹೌದು. Unless you check, you will not come to know. So once you come to know you're a diabetic, you have to screen not only for the blood sugars, but the risk of whether you have underlying complications.
ಓಕೆ ಓಕೆ ಓಕೆ. ಈಗ ನಿಮ್ಮ ಹತ್ರ ಯಾರಾದ್ರು ಡಯಾಬಿಟಿಕ್ ಟ್ರೀಟ್ಮೆಂಟ್ಗೆ ಬಂದರೆ ವಾಟ್ ಇಸ್ ದ ಫ್ಲೋ ಆಫ್ ದ ಟ್ರೀಟ್ಮೆಂಟ್?
So flow of the treatment is we need to first keep the blood sugars, the blood pressure, cholesterol. So what we say the ABC of management, A1C, blood pressure, cholesterol. Apart from that, kannadu, kaladu, we have to screen for that. Another complications idena, we have to send it to that particular specialty. For example, retinopathy inta kan olagade barutte. So if they have retinopathy, immediately they have to meet ophthalmologist. ಕಾಲಲ್ಲಿ ಸಪೋಸ್ ನ್ಯೂರೋಪತಿ ಇದೆ, ಇಟ್ ಇಸ್ ವೆರಿ ಸಿವಿಯರ್ ಪೇನ್, ಬರ್ನಿಂಗ್ ಸೆನ್ಸೇಷನ್, ಇಲ್ಲ ಕಾಲಲ್ಲಿ ಏನಾದರೂ ಗಾಯ ಬಂದಿದ್ದು, ವಿ ಕಾಲ್ ಇಟ್ ನ್ಯೂರೋಪತಿಕ್ ಅಲ್ಸರ್ಸ್, ದೆನ್ ವಿ ಹ್ಯಾವ್ ಟು ಸೆಂಡ್ ಇಟ್ ಟು ಅ ಫುಟ್ ಸರ್ಜನ್ ಆರ್ ಎ ನ್ಯೂರಾಲಜಿಸ್ಟ್ ಫಾರ್ ಅ ಬೇಸಿಕ್ ಎಕ್ಸಾಮಿನೇಷನ್. ಮತ್ತು ಕಿಡ್ನಿದು ಅರ್ಲಿ ಸ್ಟೇಜ್ ಆಫ್ ಕಿಡ್ನಿ ಡ್ಯಾಮೇಜಲ್ಲಿ ಮೈಕ್ರೋ ಆಲ್ಬ್ಯೂಮಿನುರಿಯಾ ಅಂತ ಒಂದು ಟೆಸ್ಟ್ ಬರುತ್ತೆ. ದಟ್ ಎವ್ರಿ ಡಯಾಬಿಟಿಕ್ ಅಟ್ ದ ಟೈಮ್ ಆಫ್ ಡಯಾಗ್ನೋಸಿಸ್ ಓನ್ಲಿ ದೇ ಹ್ಯಾವ್ ಟು ಚೆಕ್ ಇಟ್. ಇಫ್ ಯು ಆರ್ ಅ ಟೈಪ್ 2, check for this test called microalbuminuria, which is the first sign of kidney damage. If you have it, we can treat it with good sugar, blood pressure, lifestyle control. But ಏನಾದರೂ ನಿಮ್ಮದು ಕ್ರಿಯಾಟಿನಿನ್ ಜಾಸ್ತಿ ಇದೆ, EGFR ಅಂತ ಒಂದು ಟೆಸ್ಟ್ ಬರುತ್ತೆ, ಅದು ತುಂಬ ಕಡಿಮೆ ಆಯಿತು, we might have to even refer to a nephrologist so that we can have more of a multidisciplinary approach.
Doctor, I think definitely these are all right things. But in our country today, with the kind of per capita income we have, some of these treatments can be very expensive, right? So what is your suggestion? What is the bare minimum things people should do who cannot afford all this, basically, right?
See, bare minimum means these things can be checked, but there are some basic tests also.
Yes.
You can't do some advanced tests. For neuropathy, we have some basic tests. Even for retinopathy, to screen the eye, we can do it in a cost-effective manner. Even for some of the lab investigations, there are labs that offer all these tests at a very affordable price. But ideally, they have to check it because being asymptomatic, unless you check, you won't come to.
Even ನಿಮ್ಮ ಹತ್ರ ತುಂಬ ಪೇಷಂಟ್ಸ್ ಬರ್ತಾರೆ. Maybe I think, I'm sure every day you may be talking to more than 50-100 people, right, with the similar issues. And I also know that a lot of patients are coming to you from different global locations or a lot of celebrities. So what is your experience with patients? Is there some interesting learnings or stories you would like to share?
Definitely. In between, I was running a campaign where we are looking at patients who are like role models because they've managed to control their diabetes very effectively. Some people have even tried to reverse it, what we call it as remission of diabetes, where you're completely free from medications and you can, have a normal blood sugar from what you are in a diabetic state. So such people, we give them a certificate and we kind of recognize them in front of other people. We call all other diabetics and probably ask them to even share their success stories. So some what I've seen is there were some younger individuals who took a very intensive lifestyle, proper diet, proper exercise, proper sleep. They managed to lose weight. So they could manage to reverse or bring their blood sugars to the normal range. And many of them I am still monitoring now. They're still in the non-diabetic range after reversing almost for 5 years. This is about the younger generation. There are some elderly people who've taken it very seriously as a challenge. They brought about drastic lifestyle changes. They completely gave up the so-called simple carbohydrates. So all rice items, sugary items like sweets and chocolates. They started taking more of complex carbohydrates, started to exercise and tried to manage their weight. And they were now, able to manage their diabetes with very minimal medications. Some of them, you won't believe, have even gone off insulin. And they're even above the age of 60, where I started insulin initially because their blood sugars were high, but because of their positive lifestyle changes, completely stopped insulin, only tablets.
And another, see, the thing what I see is there's some people who get maybe some small wound in their foot and then it becomes unmanageable, right? So what is the story behind that? Why it happens like that? How that can be controlled? Because I've seen many of people in my own connect suffering with that, or maybe getting into the amputation stage later. So why that happens? How can we control that?
Correct. So what you're talking about is diabetic foot ulcers, which generally occur on the feet. It can occur mostly on the sole of the feet. Now, if you see in India, mostly we call it neuropathic ulcers that happen in an insensate feet. That means they had neuropathy for several years and the sensation is completely gone. Then what happens? There is a triggering factor. They walk barefoot, in the hot sun. They walk barefoot in the temple, and because of not having the sensation, they develop an ulcer in the sole of the feet. That becomes infected, and if you don't address that infection with proper foot care, sugar control, antibiotics, blood supply, then that can go into a gangrene. Once it's a gangrene, means that tissue is dead. Then it leads to amputation. If you see Western countries, they have something called ischemic ulcers. It's because of the temperature, cold climate, smoking, that reduces the blood flow to the feet. So it's because of reduced blood flow, they get ulcer in the feet. Whereas in India, it is more of neuropathic ulcer. You have neuropathy in the feet, no sensation, you get hit or you get thermal injury, and that goes into an ulcer. And neuropathic ulcers can be prevented with proper foot care, with proper education and advice. Otherwise, it can go into an amputation.
Yeah, understood. You spoke about simple and complex carbohydrates, right? So a lot of people say that, oh, I have got sugar, but ನನಗೆ rice ಬಿಟ್ಟಿದ್ದಾನೆ, ಚಪಾತಿ ತಿಂತಾ ಇದ್ದಾನೆ. I'm not sure whether that's the right thing to do. What is your opinion about what kind of food pattern we need to follow?
So, generally, for a diabetic or even someone who's at the risk of getting diabetes, because many people they have diabetes in their family, or they're obese, or they lead a very sedentary lifestyle. Such people, they should try to start inculcating complex carbohydrates in their diet. Complex carbohydrates means they are millets, they are jowar, bajri, anything which is unpolished. So the bran or the husk of that particular cereal is maintained. So what happens when they consume that? It will not get digested very easily. So it will go to the last portion of the intestine where it will get digested. And it is also good for the gut microbes. Now there is a lot of theory about good gut microbiota. So it becomes like a probiotic. If you improve your gut health by consumption of complex carbohydrates, that immediately reduces the spike in the blood sugar. If you take rice, immediately your blood sugar can spike. That much burden on your pancreas to release insulin, and that will lead to diabetes in the future, or it can worsen your blood sugar control in an existing diabetic.
Doctor, we hear a lot of people saying, oh, ನಂಗೆ ಡಯಾಬಿಟಿಸ್ ಬಂದಿದೆ, ಶುಗರ್ ತಿನ್ನೋಂಗಿಲ್ಲ, ನಾನು ಬೆಲ್ಲ ತಿನ್ಬೋದು, I can eat jaggery or I can eat anything else. Only sugar I should avoid. So what is your maybe the suggestion there?
So this is something that many people try, like I said, these are all some age-old practices that they try, that you try to go for substitutes. If I can't take sugar, I'll take jaggery, or I'll take other artificial sweeteners or natural sweeteners.
Yeah, tablet ಎಲ್ಲ ಹಾಕೊಂಡು ಕಾಫಿ ಟೀ ಎಲ್ಲ ಕುಡಿತಾರೆ.
So you have these, natural sweeteners like stevia. Well, you can do that. Of course, it is much better than, taking direct sugars. But there again, it depends upon your blood sugar control. and what effect it is having on your blood sugars. So jaggery doesn't mean that it will not spike your sugars. It also has some amount of glycemic index, but it is slightly better than direct sugar. Now with all this technology available, we have the CGMS where we can apply a sensor, and you only can see after taking a jaggery, you can check your blood sugar. What is it doing? Is your insulin able to cope up with it? Is your sugar being metabolized after taking jaggery? So all these now newer technological advances are there. But as a general rule, it doesn't mean that if you are a diabetic, you can take a lot of jaggery. It all depends on your sugars and your body's response to taking jaggery.
Yeah, point noted. Like you're saying, diabetes, we may call it as related to sugar, but it is not only sugar. It's a lot of other things included. Doctor, another question is, what I see is when people get diabetic, like a lot of my own friends, early 40s, mid 40s, I somehow feel they suddenly lose interest in life. They feel, oh, life is done. I have got diabetes, and I have to take tablet, and its own maybe the perceptions. What is your opinion? How should people look into it? Like how to balance both diabetes as a physical issue and also how to balance the mental issue along with that?
Yeah, so if you see depression and anxiety, in fact, depression is the most common mental disorder that you get along with diabetes. But once you hear that you're a diabetic, and especially if you have other complications, you go into a depression. And a lot of studies have shown that. Other thing is anxiety. You become anxious about a lot of things. Oh, I have to eat correct. I have to sleep well. I have to exercise regularly. I have to follow a good lifestyle. So all that creates a lot of anxiety. I have to take my medications. I have to check my sugars. I have to check for complications. I have to go to my doctor periodically. I think if you structure it well, I feel diabetes is nothing but it is trying to inculcate discipline in you. The discipline what you could not follow for many years. Now nature or God has given you this disorder so that you bring in discipline. You try to streamline your lifestyle. So it requires a very structured way of leading your life each day. If you do that, I have a lot of patients, even as old as 90, who had a disciplined lifestyle, still on fewer medications, not developed any complication, and they're living healthily.
ವಂಡರ್ಫುಲ್. ಇನ್ನೊಂದೇನಪ್ಪ ನಾನು ತುಂಬ ಕಡೆ ನೋಡ್ತೇನೆ, ಹೆಂಡತಿಯನ್ನು ತುಂಬ ಗಂಡನನ್ನು ಕಂಟ್ರೋಲ್ ಮಾಡ್ತಾರೆ. ಏ ಅದು ತಿನ್ಬೇಡಿ, ಇದು ತಿನ್ಬೇಡಿ, ಆ್ಯಂಡ್ ಡೋಂಟ್ ಈಟ್ ಪಾಯಸ ಇನ್ ಅ ಫಂಕ್ಷನ್, ಡೋಂಟ್ ಈಟ್ ಸ್ವೀಟ್. The interesting thing what I observed is the same husbands, I think, who are leading a more healthy life, once they start, once they realize that they got diabetic, then I see a lot of them now start getting tendency of eating more sweets. So is that something to relate it to the mindset, or is it like really the side effect of diabetes where you want to eat more sweets?
Yeah, see, that it becomes more of a taboo, in society. Everybody, once they know you're a diabetic, it's your own near and dear ones. First, they'll try to put in restrictions. Then once you go out for function, a lot of people, if they know you have, they'll try to restrict you. So I think you don't need to have too much of restriction as long as your blood sugar is under control. You can have a payasa, you can have mangoes, but provided your HbA1c is maintained less than 7, you're taking your medications, you're following a lifestyle, taking your insulin if required. So it doesn't mean that once you're a diabetic, you can't take sweets at all. You can take if it is under control. And for some people, I've seen that despite taking all these sugar containing foods or sweets, it does not spike up as much because they lead a good lifestyle, taking their medication. So such people have the luxury of taking sweets as well. So the bottom line, the message here is that you have to have your sugar under control to have the luxury of taking more sugary items.
Okay. Interesting. Doctor, I think once the HbA1c crosses some level, you'll start with insulin, right? So, is it the only way to manage the diabetes challenges, or how to manage this for in the longer run?
Yeah, so what happens, all these type 2 diabetics, especially if they have it for a longer period of time, then the beta cells which make insulin, they diminish their ability to produce insulin. Then they have insulin resistance. Also, there are other organs like the liver, the kidney, the fat cells. All this lead to derailments in metabolism. That means it's a stage that your diabetes is worsening, and the medications can only work to that much extent. Then they go into the insulin requiring state. So many people are reluctant to take insulin. So my message to them is that, whenever you've been advised insulin, follow your doctor's advice. Do not, kind of restrict what your doctor is saying, because insulin is a life-saving medication. If you don't take insulin and if your sugars are high, then you go into organ damage and you spend a lot of money. Then by the time it's too late. So insulin is a very good drug. It's in fact a natural hormone found in everybody's body. It's just that your body is not making adequate, so you have to give it from outside. And only thing is with insulin, the main side effect is hypoglycemia, low sugar. So low sugar, if you get, you'll have to talk to your treating physician. Try to reduce the dose of insulin. Nowadays, there are very modern insulins available, where hypoglycemic risk is very minimal. You have monitoring systems like CGMS, can monitor the sugars and make titrations. You also have insulin pump. Recently, for one of my type 1 patient, I had put an insulin pump. She's doing much better rather than taking insulin injections. And every person who's taking insulin should have a glucometer at home so that you can identify hypoglycemia or hyperglycemia and take the corrective measures accordingly.
Got it, doctor. I think it's not taking insulin. You're trying to say that it is not bad. It is required. Otherwise, the complications can be even worst.
Correct.
Doctor, I'm curious to know, how was your childhood? Like, what made you to choose this field of working on this diabetic challenges?
So, if you see in my family only, there's a family of doctors, my grandparents, and my own mother, she's a doctor herself. So that always gave me an inspiration that probably in the future, I need to consider this field. Because I've seen my own mother who's into a lot of service, and you can influence the lives of people. There's a lot of gratitude that you get from people. So that, at an early age itself became a motivation for me that I need to look at this field more seriously. Now, coming to diabetes per se. Now, the first time that I heard about this term or experienced that was one of my own school friend who had type 1 diabetes. I mean, at that point, we only knew that he has probably a disease because he had to carry this insulin with him. Those days, insulin was not available in a pen. So he used to carry a small vial and he used to have syringes. And sometimes his parents used to come home or come to school and deliver the insulin. So we used to think, he has a disease. We need to stay away from him. Now I can relate to it. That what kind of a social taboo can be there if you're a diabetic and taking insulin. So that was the first time I heard about this term called diabetes, and someone seeing a person live taking this injection, so afraid of taking injection, or his parents coming and giving just before lunch. Then of course, as time passed by and once I got into the field of medicine, I saw that diabetes is running within my family. My parents are diabetics, my grandparents are diabetics, and people around me, my uncles and aunts, other friends and relatives. So this became a very common terminology which we are hearing in a lot of functions, in my younger ages. And then I got more curious about it. Then you started to learn during your medical field. And then I wanted to pursue more into this field, explore. And then as you're exploring, you kind of learn that now it's become a disorder which is hitting almost every family. Every individual, every family has some individual who has diabetes. And then now with the numbers exploding, me doing a lot of work, a lot of research, I've published a lot of papers. I've learned a lot about it. And, right from a young age, I've been following a good lifestyle, which I try to educate to my patients as well. Many of them youngsters who lead very, very bad lifestyles in terms of diet, exercise. I try to share my experience.
Yeah, I think that's a very good point you got here. ನಂಗೆ ನೆನಪಿದೆ, ಸ್ವಲ್ಪ ವರ್ಷ ಹಿಂದೆ ನಮ್ಮ ತಂದೆ ತುಂಬ ದಪ್ಪ ಇದ್ರು ಆ್ಯಂಡ್ ಅವರಿಗೆ ಡಯಾಬಿಟಿಕ್ ಇಶ್ಯೂ ಇತ್ತು. ಒಬ್ಬರು ಡಾಕ್ಟರ್ ಇದ್ರು, ಅವರು ಒಳ್ಳೆ ಡಾಕ್ಟ್ರು, ಸಿಕ್ಕಾಪಟ್ಟೆ ಒಳ್ಳೆ ಡಾಕ್ಟರ್, ಆ್ಯಂಡ್ ಹಿ ಟ್ರೀಟೆಡ್ ಲಾಟ್ ಆಫ್ ಪೇಷಂಟ್ಸ್ ಆ್ಯಂಡ್ ಗ್ರೇಟ್ ನಾಲೆಜ್ ಹಿ ಹ್ಯಾಡ್. ಸೊ ಐ ಟುಕ್ ಮೈ ಫಾದರ್ ಟು ಹಿಮ್ and he was advising my father to reduce weight and all those things and giving suggestions. And when my father came out, my father was a person who never ಮನ್ಸಲ್ಲೇನು ಇಟ್ಕೊಳ್ತಿರ್ಲಿಲ್ಲ, ಅವ್ರಿಗೆ ಅನ್ಸಿದನ್ನು ಹೇಳ್ಬಿಡೋರು. ಸೊ ಯೂಸ್ ಟು ಟೆಲ್ ಮಿ, he told me, ನಿನ್ನ ಫ್ರೆಂಡ್ ಡಾಕ್ಟ್ರಿಗೆ ಫಸ್ಟ್ ವೆಯ್ಟ್ ಕಮ್ಮಿ ಮಾಡ್ಲಿಕ್ಕೆ ಹೇಳಪ್ಪ, ಅವರೇ 130 kg ಇದ್ದಾರೆ, ಅವ್ರು ನನಗೇನು ಹೇಳೋದು ಅಂತ. Right? In that way, I feel somewhere as a doctor, that especially you are advocating lifestyle and good way of living, it's important for you to follow that, which I know that you are following it very, very rigorously. Can you tell us how is your lifestyle? What do you do every day?
Yeah, so I like to practice what I preach. So as you rightly said, unless you're fit, it's no point preaching it to others who might, look at you in a very astonished way. So my lifestyle, if you see, I exercise almost regularly and I try to follow a very disciplined diet as well. So almost every day I've been doing yoga for the last 17 to 18 years. That is some amount of breathing techniques, what we call pranayama, and some yogic postures, what we call asana or flexibility exercises. That, it's like almost for last 17 years without fail. Every day I try to do at least for 15-20 minutes a day. So my day starts off with that early in the morning, the first thing. And then maybe thrice, 4 times a week, I try to do some resistance training, go to the gym, lift weights. Because if you have little muscle mass, then that can allow for better glucose uptake into tissues. It reduces your insulin resistance. It reduces the burden on the pancreatic beta cells. So it can prevent diabetes. Now, since both my parents are diabetics, there's already a family risk that is it. 50% risk is already there. The other 50% I can work with. That is my diet and exercise. My diet also am very strict. I try to take more of complex carbohydrates, a lot of vegetables and fruits. I try to stay away from junk food, limit it to only 1 or 2 cheat days a week. I stay away from alcohol and smoking, maybe only social drinking. So this kind of a discipline in terms of diet, exercise can be followed, and sleep of at least about 6 to 7 hours. Then I think most people can take care of their diabetes or they can prevent diabetes. Another last thing is weight management. Now, I've been having the same weight for the last almost 20-25 years. And that again, I attribute to my diet, my yoga, being very cautious, mindful. Mindfulness is very important in terms of what you eat, what you exercise, and you should enjoy that moment. And it's all about the hormonal interplay. Early morning is the best time to exercise because a lot of stress hormones are released. You can negate or nullify that effect by doing yoga or any form of relaxation, breathing exercises.
Good. I think that's lot to learn. I think thanks for sharing that, doctor. Changing the topic a little bit, what do you think the future of diabetic medicine field, say like next 1, 2, 3, 4, 5 years? What do you predict? How are the things going to change? And also with AI coming in now, do you think it's going to positively or negatively, for that matter, right, impact the future of diabetology?
Yes, definitely. I think not only diabetes, but all non communicable diseases. AI, machine learning, use of technology is going to play a very big role. Already it is playing because we use a lot of technological gadgets. For example, self monitoring, we use these CGMS devices. We use a lot of insulin pumps. In fact, the latest insulin pump, we call it the artificial pancreas. So there is a lot of artificial intelligence that's used in that, wherein the messages are sent to a sensor. The sensor will send the blood sugar, the values to the insulin pump. So there's a lot of auto regulation going on. So a lot of technology has come into play. So future is a lot about precision medicine, personalized medicine. There's a lot of genomic studies, genomic testing that is going on that will tell you what is your personalized response to certain medications, foods. If you take certain foods, your genetic response to that. So the direction of diabetes management is going towards more of precision, personalized, artificial, and a lot of technological driven management.
Doctor, I know you as one of the best badminton player I have played with, right? So, can you talk a little bit about your passion and interest towards badminton?
Yeah, so sports is something from a young age I've been playing. I started off with football initially, where I played under 10, under 12, under 14 for my school. Then I went on to play cricket. I played a lot of cricket. Then finally, I developed interest in a lot of racket sports. So I started to play table tennis. I was pretty good at that. Then I went on to play tennis, and finally, I took up badminton, which I felt this is what my heart wants, And now I've been playing for last 20, 25 years. And yeah, I think it's a very good sport. It helps in flexibility. It helps in cardiovascular health. It keeps you mentally very calm. It alleviates depression, anxiety. So for overall flexibility, cardiorespiratory fitness, and for mental health, I think it's a very, very good sport. Uh, The only thing is it's sometimes injury prone if you don't make the right moves or if you don't contact the shuttle in the right way. So those things you'll have to be careful about. But I think it's a wonderful sport. And I've seen even during COVID period where we were playing, I think it helped me. I didn't get COVID. So probably it was one of the factors that helped me to
Yeah,
prevent
yeah,
COVID.
yeah, yeah. I also remember because though like we are not officially got COVID, maybe a couple of days we got fever, but I think it didn't create any impact. It just vanished.
Didn't
Maybe
need
you're
to
right. Badminton would
hospitalization.
have helped us a lot. And when it comes to some lessons from your patients, you have spoken about how your patients have like worked and reversed diabetes and how you recognize them, but what have you learned from patients? Is there some maybe the lighter moments you want to share?
So I've learned a lot from patients in terms of their lifestyle, certain practices, rituals that they do, but few, lighter moments. Because one of the complication of diabetes is erectile dysfunction that men get, and it's a very very sensitive topic. It's a very unrecognized complication which men are very very apprehensive. It's like a male ego that comes
Uh-huh.
into play,
Uh-huh.
and they have to talk about it. So many times in front of their wives, they're trying to hint it. They won't directly say,
Uh-huh.
or the wives will try to hint that, because they want their husbands to be having good health.
Uh-huh.
So they'll say he feels very weak, or he's not as strong as a man that he used to be. So that when that topic comes, it's a very, very, it's a kind of a humorous thing that we need to touch upon in terms of diagnosing, management. In fact, many of them come only for treating that. They don't even want to get their blood sugars controlled. So that is important. If you control sugar, then next step is to treat that. So there have been some funny instances there. And lastly, another thing I remember is there was this very interesting patient, young guy. He wanted to get married and he had type 2 diabetes. So he told me that, I don't want to disclose this to my wife. And we told him, see, you bring your wife, we can counsel her as well. It's not like a disease, it's a disorder. Everybody gets it. And he hid it. He got married, and this guy was taking insulin. So every time he used to, go to the washroom to take insulin. So wife was always very suspicious of him. What is he doing? Why is he doing something very discreetly? And even on a honeymoon or wherever he went, he said, just give me 2 minutes before lunch, or, just taking insulin at bedtime. Then once she came to me as well, and this guy said, tell that I have only mild diabetes, taking few medication. So she was thinking he's on drugs. He's taking it very secretly. So then finally, I had to break out the news and I had to tell him as well, let us be frank and tell that you're on insulin. It's not a life-threatening thing. The wife took it sportively, but there were a lot of issues once they went back because he had hit this issue. So she was very, very upset. Why didn't you disclose? So I think one message here is that if you have the condition, if you're going to get married, always disclose it to your partner. Because once it is discovered, then it might turn out either ways. So, but it was very humorous because in terms of how he was trying to hide it from his wife,
Yeah,
he said,
it must be very tough,
yeah.
right? So, doctor, we were talking about you're associated with Apollo from quite some time now, and there are like many institutes in India or many hospitals who are treating diabetes, and you have multiple opportunities to work at different places. But what is the different you feel or difference what Apollo is bringing compared to other places, and why you are associated there from quite a long time?
So Apollo, the journey started maybe about 12 years back in 2013. And I recollect that is when they started these sugar clinics. And what I liked is that they had a holistic way of managing everything what I thought about of trying to treat diabetes, the metabolic comorbidities, screening for these micro macrovascular complications. So everything under one roof with the adequate staff, with all the education and awareness. And I've been very happy that the management has been supportive. And the main difference I saw was during the COVID period. So during COVID, when we all went to teleconsultations, we could not see the patient physically. Apollo immediately came up with a model which was end-to-end care. So the Apollo diagnostic, pharmacy, everything was linked together. So for example, if you're a patient who's consulting me from Bihar, I have a teleconsult with you. I tell you to do the test, which the Apollo network diagnostic will get it done. After my consultation, the prescription will go to the nearby Apollo pharmacy, will deliver the medications to you. So for the patient, it is end to end. The diagnostics, the consultation, and the medications that were delivered doorstep, which is continuing even now. With Apollo, they have this 24/7, and I do still a lot of online consultations. So that was one of the biggest difference I think Apollo could bring to the table, which none of the corporates, because Apollo is there almost pan India. And that again has been something, which was very helpful for me. And I've been very happy with Apollo so far.
Excellent. Maybe the last question from my side. I also know that you have patients coming from different part of the globe, right? That makes me personally feel very proud that, like my friend Dr. Balaji is treating globally. It's not that in their places they don't have hospitals or doctors, right? They come to India and they come to you and they come to many people like you who are very qualified and whom they trust. So why that is happening? Like, do you think India has a maybe a better approach towards the management of diabetes? Or
So there are two responses to this. One is that, of course, I have a lot of online reviews. So if you go and search in Google, my center would be one of the top in Bangalore. So they see that, and with expectations they come. Now, when you talk about global patients, I have had patients from Sri Lanka, Bangladesh, even from some of the African countries, from Congo, Rwanda, Nigeria. Some people coming from Middle East. I've had a lot of people from Oman, from the United Arab Emirates, or even from Qatar and Saudi Arabia come to me. Even from Europe, I had patients from Netherlands, from US, they had come. So most of them have seen the online reviews, or they had some friends, the NRIs who came to me for treatment. They put in a word of mouth, and they've come to me for treatment. So that is about my aspect. Now, coming about the aspect of why India, I think India has one of the best doctors across the world, because I feel that they're very good clinically, they're very good in terms of diagnosis, because we're exposed to so many patients. The patient load, the conditions that we see might not be as much in Western countries. So Indians are, exposed to a whole array of conditions. So we are good in diagnosis. Secondly, management. In India, it is easier to get medications because they are much cheaper as compared to Western countries, and we have all kinds of medications. India, in fact, is known as the pharmacy for the world. All medications at a lower cost are produced and even exported across the world. So we have that luxury to get the tests, to give the medications, and we have the expertise. So that is one of the reasons I think why people come from across.
interesting. Thank you, doctor. It was really nice speaking to you. And I'm sure people who are watching this would have learned a lot about diabetes. And if any of them want to contact you, you're in Apollo Center in Bangalore in Padmanabh Nagar, right?
Correct. I'm working with Apollo Sugar Clinics. They can Google my name, or they can just put Apollo Sugar Clinic, and they will get my contacts, and they can, reach out to me.
Doctor, do you want to give any message to the younger generation?
Yeah. So any individual who's above the age of 30, I would recommend that you need to screen for the presence of diabetes and metabolic conditions, especially if you have a family history of diabetes, or if you're leading a sedentary lifestyle, or if, in the case of a woman, you've had gestation diabetes in the past. Because diabetes is a silent disease, you won't come to know anything. So screen yourself, go for health checks at least once a year. Screen for the complications of diabetes, especially heart disease. Most diabetics get silent heart attacks. Get an ECG, treadmill test, echocardiography at least once a year, so that if you have any of the heart disease, rather than getting a silent heart attack and dying, you can pick it up early and intervene at an early stage.
Doctor, I would like to personally thank you for giving this time to us. And I always believe that your profession is a very, very noble profession because business is important, but business ups and downs can be managed. But what you're doing to make sure that somebody is healthy and somebody's diabetic is controlled, which has a holistic impact on the person's life and his family's life and social life. So truly appreciate the work what you're doing. Thank you, doctor.
Thank you so much.